We'll be seeing about applied aspect of inguinal canal, that is inguinal hernias. So for this there is two types of hernias. One is direct hernia, one thing is indirect hernia. So indirect hernia, it's what is hernia? It's nothing but protrusion of the abdominal contents coming out. So that if it is passing through the inguinal canal, that you are calling it as inguinal hernias, which are related with the inguinal region. So direct and indirect. So in this direct, again you have lateral and medial. On which basis we are telling this direct as lateral and medial is related with the posterior part of the anterior abdominal wall. There is a triangle. In the midline we have a muscle called rectus abdominis. This is if you are seeing it from the abdominal part. This is rectus abdominis muscle. Then below this inguinal canal, what is that artery related with our deep inguinal ring? Inferior epigastric artery. Now, so this is forming a triangle that is called Hesselbachs triangle. So Hesselbachs triangle, what are the parts? Medially it's having rectus abdominis, laterally inferior epigastric artery, base is formed by the inguinal canal. Again, this is again divided into medial and lateral by one obliterated umbilical artery. This we are calling it as medial umbilical ligament. So this divides that into medial and lateral. So any contents coming out through this Hesselbachs triangle, then that you are calling it as the direct. So anything related with the Hesselbachs triangle, if the abdominal contents are coming out through this Hesselbachs triangle and then coming into the scrotum through the superficial inguinal ring, that you are calling as a direct hernia. Again, in that, what is the difference? If it is going in between the rectus abdominis and obliterated umbilical artery, that you are calling it as the medial direct inguinal hernia, and if it is in between the inferior epigastric and obliterated umbilical artery, that you are calling it as a lateral. Then what is the indirect inguinal hernias and direct inguinal hernias? So as you have seen, there are two openings through related with the inguinal canal, right? Triangular one is superficial inguinal ring, oval one is the deep inguinal ring. So if the contents of the abdomen, it might be peritoneum covering it and some abdominal loops. If they are passing through the deep inguinal ring, deep ring, then they are entering into the inguinal canal, passing through that and coming out of the superficial inguinal ring, and at last in males they may get into the scrotum. This is the superficial inguinal ring. So this is called the indirect inguinal hernias. If the same thing is happening through this will be where you have the Hesselbachs triangle. The abdominal contents will pass through the superficial inguinal ring and coming into the scrotum, that is the direct. Indirect, what is the course of the indirect inguinal hernia? They will be passing through the deep inguinal ring, then going obliquely through the inguinal canal, then coming out through the superficial ring, and they may enter into the scrotum or they may stay somewhere near that superficial inguinal ring. So what is the demarcating thing? And in this again you have lateral and medial direct inguinal hernia. So suppose in this indirect inguinal hernias, how do you say it is, how do you differentiate? Anterior superior iliac spine, pubic symphysis, then we have this inguinal ligament, then this is your inferior epigastric artery. So this any hernia, suppose this is a hernia, it will be having a neck, and this will be the hernial sac, and it has some coverings in this sac also, and contents. So contents may be only a peritoneum, along with that some intestinal roots. So coming back to this indirect inguinal hernia, so if this is inferior epigastric artery, lateral to that we have this deep inguinal. So the neck of this hernials will be lateral to inferior epigastric artery, and they come out through this part. So this is indirect inguinal hernia. Then direct one, it will be directly passing here. So apart from this, what are the other hernias you have seen? There will be femoral hernias, epigastric hernias, lumbar hernias. So this is concerned with your, and apart from that, direct inguinal hernia is somewhere near this pubic tubercle and pubic symphysis, right? So medial to this pubic tubercle, you are calling it as the direct hernias. That is this neck of the, if the neck of the hernial sac is medial to the pubic tubercle, that is how you differentiate it. Inguinal hernia from a femoral hernia. Femoral hernia will be lateral to this pubic tubercle. This is symphysis. This is tubercle. This will be pubic crest. So direct inguinal hernia will be medial to the tubercle, femoral hernias will be lateral to that. And how do you differentiate a direct from indirect? Direct will be, this is inferior epigastric. Direct will be medial to the inferior epigastric artery. That is, you can say, neck of the hernial sac. What about this indirect? Indirect neck of the hernial sac will be lateral to the inferior epigastric artery. So your homework is, you need to know what are the coverings of this hernias.